Chapter 5 RBC Disorders. Thalassemia. Thalassemia is an anemia due to decreased production of globin chains of hemoglobin. Decreased globin chains will result in decreased production of hemoglobin and it will result in microcytic anemia. Its inherited mutation carriers are protected against Plasmodium falciparum malaria. It's divided into alpha and beta thalassemia based on decreased production of either alpha or beta globin chains. Normal types of hemoglobins are HbF, HbA, and HbA2. Alpha thalassemia is due to a gene deletion. Normally there are 4 alpha genes present on chromosome number 16. One gene deleted, it's asymptomatic, but when 2 genes deleted, mild anemia with increased RBC count. Cis deletion is associated with increased risk of severe thalassemia in offspring. Cis deletion is more dangerous than trans deletion. Cis deletion is the one when both deletions occur on the same chromosome, while trans deletion is the one when one deletion occurs on each chromosome. 3 genes deleted, severe anemia, beta chains form tetramers. HbH that damages RBC, HbH is seen on electrophoresis. In alpha thalassemia, if a patient does not have enough of alpha globin chain, so in this way beta chain will be added to the beta chain and result in beta chain tetramer, HbH. HbH have 4 beta chains. 4 genes deleted, lethal in utero, hydrop fetalis. Gamma chains form tetramers, Hb bars that damages RBC. Hb bars is seen on electrophoresis. Here in this case, due to not enough alpha chains, so gamma chain is added to the gamma chain and form gamma tetramer, gamma chain tetramer, Hb bars. Hb bars have 4 gamma chains. Beta thalassemia is usually due to a gene deletion, point mutation in promoter or splicing sites, seen in individuals of African and Mediterranean descent. 2 beta genes are present on chromosome number 11. Mutation in result in upset, beta naught or diminished production of beta globin chains, beta plus. Beta naught means no production of beta chains, while beta plus means decreased production of beta chains. Beta thalassemia minor is the mildest form of disease and is usually asymptomatic with increased RBC count. Microcytic hypochromic RBC and target cells are seen on blood smear. Hemoglobin electrophoresis shows slightly decreased HbA with increased HbA2 and HbF. HbA2 increases 5%, but HbF increases by 2%. Normal is 1%, while normal HbA2 is 2.5%. Beta thalassemia major is the most severe form of disease and present with severe anemia a few months after birth. High HbF at birth is temporarily protective. Pathogenesis of beta thalassemia major. Beta globin chains reduced. It will result in excess unpaired alpha chain, so it will precipitate it and then damages membrane. Extravascular hemolysis will result in splenomegaly, erythroblasts are damaged, ineffective erythropoiesis, increased iron absorption. It will result in iron overloaded. Unpaired alpha chains precipitated that damages RBC membrane, resulting in ineffective erythropoiesis and extravascular hemolysis. Removal of circulating RBC by the spleen. Mesoerythroid hyperplasia ensues, resulting in expansion of hematopoiesis into the skull. Reactive bone formation leads to crew-cut appearance on X-ray and facial bone chipmunk fascies. 2. Extramedullary hematopoiesis with hepatosplenomegaly. 3. Increased risk of aplastic crisis with parvovirus B19 infection of erythroid precursor. Chronic transfusions are often necessary that leads to increased risk for secondary hemochromatosis. Hemochromatosis means building up of iron in the tissues. Smear shows microcytic hypochromic RBC with target cell and nucleated RBC cells. Electrophoresis shows HbA2 and HbF with little or no HbA. Crew cut appearance figure 5.4. The investigation of choice for thalassemia is hemoglobin electrophoresis. Microcytic anemia etiology. The most common causes responsible for microcytic anemia includes thalassemia, anemia of chronic disease, iron deficiency anemia, lead poisoning, and sideroblastic anemia. These are the most common causes responsible for microcytic anemia. The laboratory findings in microcytic anemia includes